get to experience the joy of parenting a child but get informed that they have reported sexual abuse. Don't know what to make of it? Don't know how to move forward? The people at childwelfare.org say that becoming a parent to a child who has been previously abused gives you the opportunity to provide comfort and security, as well as help him or she build resilience and effective coping strategies for the trauma that they have or may have endured. They recommend parents to begin with educating themselves, understanding the impact of sexual abuse, establish and uphold family guidelines for safety and privacy, and seek help when needed. The urgency for these unique parents to educate themselves is of substantial importance, as foster children come into their lives with an unfortunate amount of needs, and it is their responsibility to be able to satisfy them as needed. Steen Baker and her team list that foster children need caring and supportive foster family relationships in order to build trust, emotional intimacy, and secure attachments. They found that for foster parents to satisfy this need, they should provide the children with a stable, affectionate, and safe environment, and that making any effort to hold conversations about their past has proved to help contribute to finding emotional support, as long as the foster parents have trusting attitudes and show genuine interest. Our question for you, our viewers, would be, besides starting conversation, how else could you provide a stable, affectionate, and safe environment for your children? One of the first things parents will find when understanding the impact of sexual abuse is that these children have higher rates of problematic sexualized behavior. According to Becker and her team, from the 13% of foster children who have been sexually abused, up to 1/4 of them will become sexually reactive and problematic due to their victimization. The biggest concern for sexualized behavior is that it is the hope for foster homes to provide a safe environment for the children to live their lives abuse-free. But once a child with sexualized behavior is brought into the environment, they become a danger for themselves and begin to jeopardize the safety for any other children within the home. According to Dr. Sue Abel, parents can expect children whom have been abused to exhibit many other symptoms, such as self-stimulation, nightmares, role-playing different parts of their abuse scenarios, physical or verbal aggression, withdrawal or shutting down, running away, and internalized self-harm. When a foster parent reached out to Dr. Sue Abel on her column for helping sexually abused foster children for how to deal with her 4-year-old child touching herself excessively, Dr. Sue emphasized that the parents should maintain a calm, supportive, and loving environment so the child wouldn't feel as though there was anything wrong with her. She asked that the parents treat her behavior as an opportunity to reteach private versus public behaviors, much like nose picking, passing gas, and belching. We then would like to ask you, how else could this mother handle her child's excessive self-stimulation? Child Welfare Information Gateway advises that parents set the following rules, some of which include not wearing revealing clothing outside of your bedroom. Seeing you in your underwear or clingy sleeping wear may stimulate confusing feelings in your child. Teaching them the proper words for body parts. This may help them talk about their experience now or in the future. And saving your cuddlings for the sofa. Do not invite your child into your bedroom for cuddles. The implementation for these rules will help fulfill these children's need for safety and privacy. According to Bullock and Farmer, children who have been sexually abused will need support in correcting disrupted behaviors, educational problems, and the effects of having disrupted parenting and family rejection. They also explain that it is common for children to show new behavioral problems once within care. They also find that effective work needs to be seen away from the home as well. They recommend the following list of policies be in place and used in order to effectively support these children all around, such as training and support for foster carers and residential workers need to be developed to help them provide the necessary, well-informed, accepting, and protective emotional environments in which therapeutic gains can be considered. Joint planning needs to be addressed. The shortfalls identified in the provision of education, especially for sexually abused and abused young people in residential settings for whom disruption in education is frequent. My final question for you would then be, do you believe your foster care training provided you with the information and confidence to help support your children? If not, do you have any professionals to reach out to? If you or anyone you know is in need of any further information or assistance, please feel free to gather more information from the resources we have used, as well as any others we have found helpful that should be appearing on the screen momentarily. As always, thank you for watching and have a great day.